I'm Andrea Perdue, the Director of Enterprise and Partnerships. And I have Michelle Winier is here from Ascension and AMITA Health with us. Okay, let's get kicked in. Michelle, as we get started, could you just give us a quick intro for yourself and an overview for the AMITA teams?
Sure. I'm Michelle Winiers. I'm the System Director of Quality and Patient Safety at Ascension, Illinois, and I support our clinically integrated network called AMITA Health. And I am the Director of Quality, basically. And so I say all roads lead to quality. Everything population health, I think, has some quality component that needs to be addressed. And so that's how I have become familiar with Arcadia and my passion for TCM and all other things population health.
Thank you. As we talk about TCM, can you help us understand from a pop health perspective what's important for you guys, what's important for you specifically, and also like AMITA in general from that organizational perspective?
Sure. We were able to see very early on that patients who came in to see their provider after a hospitalization had much lower rates of readmission compared to those who didn't. But we didn't have the skill set necessary to kind of really dig into the claims to figure out who wasn't getting the TCMs, why they weren't getting them. And so we really wanted to get down and dirty with the data and be able to drill down to a provider level to see if we could make change. We have our care management team that was very aggressive in the post-acute space. They were going after patients. We also had our hospitals that had the service lines, and they were actually making workflows and things while the patient was still hospitalized. But what could we do in the ambulatory space? And so really we found that from a quality perspective, we can hone in on those primary care providers to see what can we do, how can we help them, what data did they need, how could we help drive the initiative to try to get more patients in to see them after discharge.
Yeah, thank you. And as you have been working through those pieces and you've been working those different teams, because I know there's been a ton of initiatives and pieces that have been discussed together and collaborated on, what are some of the barriers that you have come up against that you are, you probably have to work through real time, but then also consistently, right?
Right. I think it's because we have so many independent providers. We have a lot of different EHRs. Many of these providers are very small independent practices, so they don't have integrated systems with the hospitals, so they don't get discharge information in a timely manner. I think that by far was the biggest barrier. And then the second is, how do we share the data securely? Those are really the two struggles. So the provider's not getting the data, and we didn't have really efficient ways of getting them the data.
Yeah. Best practices there as you have worked through some of those barriers?
Yeah, so we do have a contract with Patient Ping.
Yeah.
And so getting those lives integrated into the population health platform has been really very helpful, because we're able to give provider practices access to Arcadia, and then they can see those patients in Ping like our care management team would.
We've touched on this a little bit, but I'm going to also ask you, because so much of this data and so much of the integration is so important. When we think about technical resources and how that works with the TCM, the AMITA approach, what's that value there for you? Where does that add value? Where does that bring value?
Yeah. So, it adds value in a lot of different ways. We know it helps cost. So it definitely helps our cost benchmarks. It helps to keep our costs lower. But it also does help our providers grow volume. It's re-engaging with their patients who may have been lost to just follow-up care in the past. Right. And it's also just helping to reestablish our network, really trying to bring people back into our network who might have gone elsewhere because they weren't realizing that they should follow up with their doctor, and now they're with a specialist and being sent all over town. So it really has been helpful for those three components.
That's fantastic. I always love listening to you talk about this stuff, because it is exactly what's needed. And then my final question for you, best practices, lessons learned. As you've worked through this, as you have kind of come across everything, what are some of the things that you would want everybody to know as you have created these programs and all of these integrations and collaborations with other teams?
I think the most important thing to know is it really has been shown to improve quality. These patients, not only does it help costs, but it does help to, like I said, bring the patient back to their primary care provider, who can be that gatekeeper and really help keep things in check. Doing that full medication reconciliation after discharge is such a big, important issue for patient safety, especially in our elderly or our aging population. So I think, just knowing that if you get the right workflow in place, it really will have a lot of different benefits.
Wonderful. Thank you so much. Team, do we have more time, or are we? I have one more question that I didn't actually tell Michelle I was going to ask her, but I actually saw the slide and I'm going to ask you real quick. You guys use outreach as one of your tools, and how are the impacts there from a text message outreach to a patient perspective here from a TCM perspective? Does that tie together for you?
You know, we haven't used the text messaging for post-discharge yet.
Yeah.
But that maybe is something that we can look into doing.
Yeah.
I think, you know, we have been seeing added benefits. Sometimes we do get replies on those reports, you know, how did you get my information? Who is this from? You know, so it's been kind of weird because we are a clinically integrated network, not a provider office. But I think at the end of the day, patients who get reminders do follow up on them in a positive way. So,
or even if they're checking to see if something like got hacked,
is legit, right?
Yeah,
Exactly. At least it engages them, which is important.
I think that's fantastic. Michelle, thank you so much for the time. We really, really appreciate it. Team, does that sound to anything else that any questions from the groups? Yep. Q&A? Yes.
Constant evolution. It really does depend on the EHR. Like for our employed medical group, we have two different EHRs, Athena and Epic. And on the Epic side, you know, we have our call center, call the patients to try to get them in for those TCM visits. On the Epic side of things, those associates can't document in the EHR. So they have to send a message outside the EHR to the manager, who then has to put that note in the EHR. And that is one component needed to bill for these TCM services. And so we often miss out on that on the Epic side. On the Athena side, it's much more streamlined and those are flowing through. And so we really have found that we just have to, whatever works best. And if it's an independent practice, you know, they're going to find their own niche, what works best for them. And we say roll with it. As long as you can meet the components and get the patients in, that's the primary goal.
Other questions? All right. Thank you, everybody, again.